and I'll get us underway with a couple of instructions. Thank you, everybody, for your continued patience, adventures in WebEx, despite well-laid plans. Sometimes this happens. So I will continue working in the background to get our speaker from Malawi. Hopefully we can troubleshoot in the next couple of minutes more. But thank you for being here today. My name is Sarah. I'm part of the PMNCH Virtual Partners Forum team. And PMNCH is getting ready for a large event in Delhi in a couple of weeks. But this is an opportunity for you, for all of us in the global PMNCH community to come together to start the discussions early and talk to one another. You will have noticed that when you came into this webinar, you were automatically put on mute. And that's so that any background noise and beeping that happens as people come in and out, that's kept to a minimum. So we're just asking to please remain on mute while our presenters are speaking. There will be opportunity to ask questions at the end of the webinar. So please keep muted until further instructed. But we don't want you to be silent. There is a chat box just below the participant list, and that is where we hope you will start asking your questions. We hope this is a space as our presenters are going over the topic. If you have a comment or an experience or a question for one of our presenters, you can type it in the chat box. Just be sure that you move the send to box to the word everyone. That way, everybody here in the audience can interact with you and get to know you a little bit better. So to help us all get to know each other, and where I always like to say, please introduce yourself in the chat box. Type it up just as Sheila has done. Type in who you are, where you're calling in from today, and which organization or country ministry you are affiliated with, just so that we get a sense of who we all are and get to know each other a little bit better as part of this virtual forum. At this point, I'm going to hand it over to my colleague and friend and co-organizer, Sheila. Oh, one second. Let me find the right person to pass the ball to tell you a little bit more about our virtual forum.
Thanks, Sarah. Welcome, everybody, to today's webinar. Very, very sorry for the delay. We'll try to make up the time shortly. Just wanted to give you a bit of background around the Virtual Partners Forum events. On the screen, you can see 4 different events that are being organized to help those of you that are not able to join us in Delhi be part of the conversation from afar. Today, we're part of the webinar series. Another event that is ongoing right now and throughout the forum are the virtual side events, which is an opportunity for you to organize something related to the themes of the Partners Forum and to share what you're doing. If you go on to the partnersforum2018.com website to virtual forum, you'll find information about how to share what you're doing, and we will gladly get that up for you. During the forum, you'll be able to watch from afar and also join in an online discussion around the opening ceremony and the 4 plenary sessions, and you'll also get a chance to get to know some of the panelists and the participants at the forum. So we are now on webinar 4 out of our 5-part webinar series. The theme this week is around women in political leadership. This is part of our theme of political leadership. And the previous 4 webinars, or the 4 as they are, is looking at the 4 different themes of the Partners Forum, and each one of the webinars was put together by the co-chairs that are planning the program. And the idea is to give you a sense and a flavor of some of the topics that will be discussed at the forum. So political leadership is the overarching theme of today, but we are focusing in on women in political leadership for this conversation. Just want to let you know that if you missed any of the previous webinars, you can find the recordings on the website in the virtual forum under partnersforum2018.com. And we'll be doing our last webinar next week on the Partnership for Maternal, Newborn and Child Health. We want to say a really, really big thank you to World Vision International for working with us on this webinar series and especially for hosting the webinars. And let's move into our webinar for today. today's webinar is going to be about an hour in length. And as I said, we're looking at the theme of women in political leadership. I'll hand over to Petra shortly to tell us a bit more about this theme and to introduce our speakers. You have a little bit of information about Petra on the screen, but Petra has also been really engaged in the planning of the Partners Forum from all kinds of hats that she's been wearing around this. So she's been thinking about the forum as a whole, and then, as I said earlier, as one of the co-chairs of this theme around political leadership. So Petra will tell us a little bit more about the speakers that we have on today's call and take us through. Petra.
Thank you very much, Sheila. Good afternoon, good morning, everybody. I'm really delighted to be here and to finally not do all the paperwork and all the kind of thinking behind, but actually being able to talk to you about what's going to be happening in India in a couple of weeks. We are very much looking forward to it. We have a very interesting group of speakers lined up, and two of them are going to be here today. We're hoping that Juliana will be able to come on to talk to us a little bit about how they've experienced being a leader, being a political leader, working in the political arena, and forwarding and pushing for the issues that are close to their hearts and important for the development and the capacity and the empowerment for women, children, and adolescents to really make a change in their lives and in the lives around them. So let me just go to our first speaker, who at the moment is online, and that's Sabrina Grover. She's Policy and Advocacy Officer at Nutrition International in Canada. And within Nutrition International, she works to advance nutrition and food security and transform the lives of vulnerable people, especially women, adolescent girls, and children, by improving their nutritional status. We know all that that is one of the very important and core pieces of our lives. Sabrina previously worked in government relations with the Canadian Real Estate Association on developing policies to help promote home ownership and to ensure that Canada continues to maintain its housing market. And she serves presently as part of the executive team of the Young Diplomats of Canada, focused on business development and strategic partnerships for the organization, and as the co-chair of the Youth 7 Summit, which serves as the formal side event to the G7 as part of Canada's 28th G7 presidency. She spent over 10 years working in developing programs for youth academic conferences focused on the United Nations in Calgary, Seattle, Portland, and New York. So Sabrina, do tell us a little bit about your personal story. You know, you have quite a number of years in this area, looking specifically at youth and academic conferences, at young people, at home and home ownership, at transformation of women and children's lives through nutrition. And I think it's really interesting to hear, you know, how have you grown, and how have you gotten to be in the places that you are, but also what are you looking forward to over the coming years?
Sure, awesome. Thank you so much, Petra and Sarah, for having me on this webinar. It was a little bit last minute, so I don't have too many slides to share with you, but I kind of just picked some pictures that I thought would be interesting to supplement my story. So I got involved in policy and the political world when I was a student. And I think that that's a really important way and a really interesting way to get involved for young women because it automatically allows you to create a community and to be part of a community that's active and generally always pushing for change. I think one of the things that really classifies youth and young people of any generation is that is the generation that is always constantly, quote unquote, being rebellious and pushing for some type of change, which I think is critical when you're a young person trying to get involved in politics. So I started my political journey as part of student politics with the student union, and then from there I moved on to being part of the political organization, the party organization in my province. And then I've also been involved, as Petra mentioned, with the Young Diplomats of Canada, which is more focused on engaging young Canadians in an international forum. One of the things that I would say for young women in particular is I think that there's quite a big difference in the way young women get involved in political or policy roles, depending on what your country experiences. And I had the opportunity yesterday, actually, to listen to 5 young women who are part of the Nobel Women's Initiative Human Rights Defenders Program. And I think it really hit me in that session that what your country experiences shapes how you get involved in politics. And I come from a extraordinarily privileged position. I'm happy to be Canadian and live in Canada. But the way that I advocate is quite different because I've never had my rights threatened. And so I think one of the things that young women in Western countries or Western liberal democracies can do is be allies to other young women who are in situations that are very different than your own. And I think that was really important as a lesson for me to learn in how we can get involved in politics, that it's not just about changing things in your own context, but it's also about using your voice to help amplify other voices that maybe don't have that same opportunity, and recognizing your own privileged positions that you might come from and putting those aside to make sure that other women have those same opportunities to advance their own roles in politics and their own policies, and to bring women up everywhere around the world. So I think that's very critical in the areas of health and wellness as well. And one of the things I kind of wanted to talk about in terms of, sorry, just one second here, in terms of like transforming the way that women are involved in politics is and I think this is a controversial opinion, but I firmly believe that in order to continue transforming a woman's role in politics and decision-making and their participation in all of these things, one of the keys needs to be quotas. And I think that from my opinions, a lot of that results in shifting social norms, and I don't think that social norms in any context have been changed enough so that someone can look at a panel of all women and say, oh, I think that they're probably going to talk about women's issues, right? Well, a panel of all women can talk about whatever issues they want to, and it doesn't necessarily have to be from a woman-centric or female-centric context. And I think that those kinds of perceptions that still exist make it so that something like quotas, which is a concrete policy way forward to actually ensure that women are at the table and are involved in these decision-making contexts, are crucial. And I think that we've seen a lot of success in quotas in terms of political leadership. There's several countries that have quotas in terms of like the Congress, or in terms of Senate or the National Assembly or at the local level. And I think that these are ways to transform the social norms in the country about the way that women are perceived and the equal playing field that they exist on with men and boys in the same context. And I think it helps to break down those barriers or those perceptions that women only bring information or context forward on women's issues. And I think that is one of the things that's the most important for me, is to ensure that we change the way people perceive women in decision-making roles, that they're there to provide an opinion on everything holistically and not just on the opinion of a woman from a woman's perspective. At a recent conference I was at, someone from a private sector company said that one of the things that they're really hoping to do is ensure that there's no more onlys, such that there's not just one woman at the table or in a room. And I think that again is really critical, because often people have said, oh, well, there's one, and that's great. So we've got that box covered. We've got that check mark. And the problem is that not only does that pigeonhole that person into taking on this burden for like their gender, for saying that all women's issues are coming down to this one person in this room, and they're not really going to be able to talk about their opinion on the issue because they're going to have to talk about the women's perspective. And I think that that's so important that we push for no more onlys, and we make those choices consciously to ensure that there are multiple people in the room that can reflect these different perspectives and different experiences. And I think the other thing I would say in terms of bringing women up and informing what women leadership is, one of the steps to No More Onlys. Is someone not on mute? No? Okay. Hello? I think, Marianne, could you mute?
Go on mute if you're not. Thank you.
All right. Well, I'll just continue. So one of the things that I think is also really critical and really important is the more women.
We're working on it, Sabrina. Sorry.
They've muted.
Okay, there you go. Sabrina, can you hear us?
Yeah, can you hear me?
Yes, please go ahead. We've muted the person not on mute.
Perfect. Sorry. So I think that one of the things that's really important is and critical is, and I think from the health perspective, we've focused on this in a lot of programming, is that we need to put women at the center of their own health and wellness and their own, programming or policies or anything that's focused on that within the health framing context. And a good example of how not putting women at the center has been negative, and I don't know if this is I think it's either related to strokes or heart attacks, is that for a long time, treatment for stroke and heart attack was done solely based on male patients. And so women were being given the same treatments as men, and it turns out that didn't respect or appreciate their own physiology, and those treatments weren't working. And so that's a prime example of how even just the slightest understanding of gender-based analysis and putting a gender lens on something like that is critical to saving millions of lives of women. And I think that that's critical for the way that we do any sort of health-based policy going forward. I think it's been said 1,000 times, but it's nothing for her without her, and I think that is crucial. And something that we do at Nutrition International for sure is we put women at the center of our programming, and we ensure that we meet their needs not only in terms of the actual science or the actual nutrition that responds to their physiology, but also how do we respond to the social norms that they face within the context that they live. How do we respond to the ideas that might be entrenched in that society, especially for nutrition? We know that women eat last and women eat least. And so just providing a nutrition supplement isn't going to change that. It's going to be a temporary intervention so that women are able to obviously improve their physiology and improve their nutritional status. But that's not going to be the change that we need in order for women to be able to participate in as full people within the community or the society. So we need to put women at the center of those decision-making contexts, and we need to make sure that we shape things around their experiences. And I think that is something that's key in adolescent and child health, adolescent, child, and women's health. And I just want to quickly mention one of the programs that we've actually developed that puts girls at the center. It's called She'll Grow Into It. And we've hoped with this program that we eliminate the middleman, and we've gone right to the girls whose health is at stake here. And we've tried to do our best to inform them about their own health and wellness and their own nutritional status, and given them the power to be able to demand change on their own. And it's been successful in, I believe when we launched the program in Bangladesh, girls were so thankful and so interested in and felt so empowered to be part of this program that they started to write letters on their own to their members of parliament or their members of the National Assembly to demand change on health and nutrition. And I think that's the kind of programs going forward that's key, is giving women and girls the power on the ground to make grassroots change and giving them the avenues to amplify their own voices to make those changes. And yeah, I think that those are kind of the main things that I wanted to touch on. Oh, actually, sorry. The last thing I would say is, and I think this is something that we talk about a lot, and we've talked about it a lot here in Canada, is that change needs to be inclusive of men and boys. That in order to change anything on women's political participation, we need to bring men and boys along, and that needs to be part of shattering the social norms. And I think that is probably one of the biggest challenges that we face. I think for young women, it's becoming easier because I think in some cases, young men and boys are starting to understand, or they're being raised in a different context versus what we saw 20, 30, 40 years ago. And so I think the change is happening, but I think that it is crucial. And it's something that we talked about this year at the Youth G7, is that breaking down social norms of masculinity in any context that's in any sort of context needs to be crucial to transforming the way everyone participates in society. So I think I will leave it there and maybe see if there's any questions. Or Petra, if you have any questions.
Thanks very much, Sandra. That was really super interesting and good to hear. I think it's Sabrina. Did I say the wrong name? I'm so sorry.
No
worries. Good to hear your perspective, and I really I stand very much behind the things you've been talking about. And when we're in the Partners Forum, it's under the Every Woman, Every Child strategy, which talks about survive, thrive, and transform. And it's the transform bit that you're talking about that really is what needs to happen, hand in hand, men and women, girls and boys, but definitely in order for that transformation to be able to take place in families and communities and societies, so that there's a new norm, there's a new normal. So thank you very much for that. I don't see anybody asking some specific questions on the line, so maybe we'll do that at the end. And let me then move into making the presentation for the Honourable Juliana Lungusi, our second speaker today. She's a member of the Malawi Parliament and she represents Dedza East. She's a Shadow Minister Health and Chair of the Parliamentary Committee on Health. She's also a public health specialist and a state-registered nurse. Through her work in Malawi and internationally, she's contributed to the significant growth and professionalization of the nursing profession in Malawi, including the development of nursing and midwifery standards and operational procedures, and coordinating the first emergency obstetric care assessment in Malawi, which provided data for the development of the roadmap for the reduction of maternal and newborn morbidity and mortality in Malawi. She successfully led a multi-sector team, which included Ministry of Health and WHO, to develop and operationalize a community health service package implemented under the Malawi Social Action Fund, addressing issues of maternal and child health towards achieving the Millennium Development Goals. So I'm really pleased that Juliana could join us, and thank you, Sarah, for the enormous persistence in making the connection happen. And I'm opening the floor for Juliana to speak. Thank you.
Thank you, Petra. Hello?
Yes, go ahead. We can hear you.
Hello? Okay. Hi. This is Juliana, and as you've rightly put it, I'm a member of parliament here. I joined our Malawi parliament in 2014 when I successfully campaigned for my position as a member of parliament for Desert East. And previously, my last job before I joined politics, I was working as the midwifery advisor in Khartoum, Sudan, under the UNFPA strengthening midwifery programs. And my intention really to join politics, it's on the basis that almost all the time we complain that things are not working. It's because of politicians. And at that time in our country, we had a scandal where money went missing in government. We called the cash gate, and everybody put the blame on politicians. And I guess when I was doing my work, I kind of got bored, and I followed the story. And it dawned on me to say, okay, if we keep on blaming the politicians and thinking that things will change, when we think we know it and we're on the other side, I don't think it will work. So my intention was, why don't I join mainstream politics? And for the very simple reason that there's so much, it's like with my work as a nurse midwife and even working with the UN in the Development Cooperation, I got a grip and an understanding of the needs of Malawi, the gaps, and what we need to do. So I said, okay, I could try to make a difference within my community of the East and see how I can spread it around, especially within the health sector that I know very well, and also the youth sector, which I worked very well, and women's agenda as a whole, because I worked in reproductive health a lot. So fast forward, here I am, a member of parliament, trying my best to make a difference in where I am. And I just feel that the interaction that I have in the community, you can really make a huge difference, assuming you have the resources at hand. But the biggest resource that we have in the community is the people themselves. You can make change by interacting with the people, by having, getting closer to them at their homes, in the environment where they are, asking them what they need, what are the gaps. I've seen some communities where we can point out that we are changing from a place where nobody knew, it had no school, no.
Oh no.
Juliana, are you there?
I see her line just dropped. And I was just writing in the chat box, she had to drive 10 minutes from her home when she realized the internet was going bad. So she had to drive to find a better spot. I think she just cut out. Oh dear. She's on the line. I'm gonna see if I can try connecting her from my end one more time. Apologies. She's apologizing. One moment.
Hi, everyone. This is Sheila here. While we're trying to get Juliana back on the line, we've put a question in the chat. Feel free to respond. The question is, what are you doing to transform your society? Feel free to put your answer in the chat box, and Petra and I will engage. And do remember to change the send to box to everyone when you send your answer. We're interested in hearing what you're doing. What are you doing in your context to address issues of women's, children, adolescent health? How are politicians in your context responding and putting Survive, Thrive, and Transform on the agenda?
Anissa, again, we are still working to get Julie reconnected. Can we, since you've offered up your idea, is this an area of work you're already working in? I can unmute you and tell us a little bit about your experience. I've unmuted you. So, Anissa, why don't you tell us who you work with and what has been your work in this area? Oh, we're not hearing you either. Audio issues abound. Sabrina, I see you typed something in the chat. Go ahead and unmute. Why don't you talk about your idea since the chat is going privately? Julie's switching to Skype, trying to log in. So talk about this positive example for women's ambition.
Oh, yeah, sorry, I didn't realize I put it privately. I will put it to everyone. Yeah, so one of the positive examples I've seen here is a NGO, which is called Equal Voice, and it encourages women's ambitions to run in political positions, most importantly by encouraging the financing of female candidates. So one of the things that obviously is a hindrance to running for any political position is the ability to raise money. And Equal Voice brings together women who exist in political positions to encourage the financing of political candidates who are women. And the other thing that the organization does is it brings, in our national parliament, we have 338 seats, and there's a day that the organization brings 338 women from across the country to the national parliament to talk about the issues that they see that are valuable to them, that they see in their communities, in their schools, with their friends, with their peers. And I think that that's a really powerful moment for young women to be able to sit in the National House of Parliament, in the seat of a parliamentarian, and be able to express their voice in a way that perhaps they haven't been able to do that in the past. And I think that that is something that from a young age you can see as impactful, and you can see how you can get to that place. And the more and more women, obviously, that are in political leadership positions, the more young women see themselves in those roles. So I think that that's a really interesting example of an organization that's dedicated both to electing more women in all levels of political office, but also making sure that those women don't go unsupported if they choose to run, that there are female campaigners, that there are financing committees that are available to get money and fundraise. I think that's a really critical thing that gets more women involved. And I think having that community and that peer support makes all the difference.
Super. Thank you very much, Anissa. I really see that there's a Sabrina. Oh, this was Sabrina. Yeah. Sorry. Oh, I'm doing it to you again, Sabrina. You're going to have to give me very bad mark for this. Thank you so much for that. And I think you're absolutely right that there are so many places where women can have voice, and it's so heartening to see that many of them are taking that voice, because I think that's where the courage comes from yourself, from Juliana, and also from Anissa, who was talking on the text earlier. So just to talk a little bit more about what's going to be happening at the Partners Forum. So one of the first groups of sessions under Plenary 1, which is on political leadership, is really focusing on women's political leadership and bringing in, under the moderation of a man. We did that on purpose so that we could have a good discussion there, from a different perspective, and change the roles around a little bit. We have a minister, we have the IPU, the International Parliamentarian Union president, we have Katja Iversen from Women Deliver, a young person, Juliana will be there as well, and a chief nurse from the chief nurse from the UK. So I think there is a lot of dynamic that can come out there, and we will definitely inform them of the discussions that we had on this session. But under that political leadership theme, we're also looking at financing and financial innovation, at specific political leadership for high-quality care for women, newborn and children, at the young leaders of today. How do they deal? How are they involved and informed in politics, and how do they inform politics themselves, and also grassroots movements and their involvement and support provided through and to political leadership. And then the last piece under that is a universal health coverage across the life course, because we're talking a lot about health, but of course, if you're only looking at women and children and adolescents as separated groups, then you're kind of siloing everyone and everything again. And we're really looking to have that continuum very, very strong and very, very present from the beginning all the way through to the end, and looking at making that transform piece of Survive, Thrive and Transform under the Every Woman, Every Child strategy really sink. So then in the second group, we're looking very much at collaboration across lots of different sectors. So not only health and nutrition, which are kind of standard for adding at the moment to health, but also, for example, what happens specifically in humanitarian and fragile settings. How do we deal with empowerment? What's the specific angle that we need to support and strengthen for full sexual and reproductive health and rights? How do we strengthen and support adolescent health and well-being, and how do we help them to obtain the access to tables, the access to voice that they need in order to help all of us achieve the transformation? Under the third group of sessions, we're looking very much at accountability, and I think that's one of the key components that we take for granted. We know there are people looking at accountability, and we're hoping that they come up with things that are important to make change for us. But I think we all have responsibility in making sure no one is left behind. Looking at social accountability as well as financial and other kinds of accountability. What's the role of the government and how is it doing its work properly? And also in humanitarian settings, again, where there are so many things that do not go as they should in normal life, and so many people's lives are impacted and endangered. It's important to look at how accountability is considered there. And then the last one, or the one I'm mentioning last, but still very important, is the one where you follow the money. So what's the money doing, and how is that? How are people accountable and held accountable for what they do with the funds they receive? But also, for example, in the corporate sector, how do they put the funds that they create, or the money they create, or that they earn, to the best use for their society and their communities? The last group of sessions are around the power of partnership, and this is to look at how working together, how we're going to continue that on into the future. We have, of course, over 1,000 participants here that we want to make sure go home with ways in which they can continue to participate in this ongoing movement around women, children, adolescent health, and around survive, thrive, and specifically transform. So there's an advocacy angle. We want to energize this movement. We want to keep it going. We want to look at partnerships for scaled-up interventions so that there are more people that can access the lessons learned and the good outcomes of positive and proactive and respectful interventions. We're wanting to address the issues around performance. Are people doing as well as they say they are? How can we can support that? How can we make that available to others as lessons learned, again, across various sectors? And looking at how can we find and sustain adequate resources, because there is so much work that still needs to happen, and there is so much that can be done with a little bit of money, but also how can we make the big sweeping changes that we need in our world right now. So I hope that this gives you a bit of a flavor of what we're looking for, where we want to go, and we very, very much look forward to hearing you, seeing you there if you're coming, but also specifically hearing you on our fully virtual Partners Forum.
Thank you, Petra. So unfortunately, Juliana is not able to reconnect. She sends her apologies. What we will do is do a private conversation with her where we can record what it is she wanted to share with us today, and we will upload that separately to the virtual forum on the Partners Forum website. So you'll still have an opportunity to hear from her, but unfortunately it will not be a dialogue today. Those of you coming to Delhi, Juliana will be there, so there will be an opportunity to engage with her there if you are there. On the screen, you see a few different ways to get involved as we're leading up to Delhi, which is December 12th and 13th. There was a question about whether this was a Canada-specific event, because some of the examples we've been talking about today are very Canadian. It is an international event. This is people from all over the world coming for the Partners Forum. And as I said earlier, if you're not able to join us in person, there will be opportunities to engage with us online through Facebook, through Twitter, through the live streaming, and through various other avenues. So all of that information you can find on the website at partnersforum2018.com. You can also follow us on Facebook or Twitter. We have our last webinar, the fifth and final webinar of this series, taking place on Monday, December 3rd. Please note, if you had put this in your calendars, there has been a date change. It is December 3rd. We will have this webinar 2 times, 6 in the morning and 2 in the afternoon GMT time. So for some of you, that's really early, and for some of you, that's really late. But we thought for this last one, we would offer 2 opportunities for everybody to get to know a bit more about the Partnership for Maternal, Newborn, and Child Health, find out what we've been doing, find out what's coming up next, and find out how you can get involved. So you will get an email automatically notifying you of the login instructions for those 2 webinars next week. And the recording from this webinar and the slides and the audio that we do with Juliana separately, all of that will be uploaded to the Partners Forum website in due course. And if you've missed the previous webinars, those are already up on the site, so you can find them there too. So thank you so much to everyone. Thank you, Sabrina, for coming in and being our lone speaker today, unfortunately, but thank you so much for all the examples that you've given and for the websites that you have shared. Those will be uploaded onto the website also, so you'll be able to find them there. And thank you, Petra.
Great pleasure.
Right. Thank you, everyone. Take care.
Thank you for having me.
Bye.
Thanks again.
Bye.
Bye.